Hello, my name is Kaur and I am going to assess your cranial nerves 1 to 12 and I have performed hand hygiene. Cranial nerve 1 is olfactory nerve that is for smell. We are not testing that today. And for cranial nerve 2, I want you to stand up, cover your right eye, look into my left eye, don't move your face, and tell me how many fingers I am moving.
Two.
Okay, and then cover your left eye and tell me how many fingers you are seeing. Just look into my eye. Look into my eye.
2, 3.
Okay, have a seat. Do you wear glasses?
No.
Do you wear contact lenses?
No.
Okay. For the second part of the cranial nerve 2, I will assess the patient on Snellen chart. With that, I will ask the patient to stand 20 feet away from the chart and ask them to cover their left eye and read the chart's lowest line that they can read. And then I will ask them to cover their right eye and then have them read the lowest line on the chart. And then I will ask the patient to read the chart's lowest line with their both eyes. And then Snellen chart's normal score is 20/20. With that, patient's cranial nerve 2 is intact. So now I'm going to assess your cranial nerve 3, and then you're just gonna look into the pen light without moving your face, okay? Just follow the pen light. Okay, and now I am going to assess your pupils. I will shine the light into your eye. It's not going to be that bright, okay? Constrict, constrict. Constrict, constrict. Okay, and with that, cranial nerve 3 is intact. Now I'm going to assess cranial nerve 4. Just follow the pen light as I bring it closer to your nose. Okay. Alrighty. With this, patient's cranial nerve 4 is intact and they accommodate. So as I have assessed the patient's cranial nerve 3 and 4, so with patient's pupils are equal, round, reactive to direct and indirect light, and then both eyes accommodate. And then for cranial nerve 5, can you bite down like you're biting? And open your face against the resistance. Open your face. Okay. And with this, I will also ask the patient to assess patient's scalp, cornea, and face sensation, and I will also assess condition and sensation of the mucous membrane, nasal membrane, and with the cotton ball. And with this, patient's cranial nerve 5 is intact. I have also assessed the patient's cranial nerve 6 while I was assessing patient's cranial nerves 3 and 4. So that was patient's eye movement. And now I am going to assess patient's cranial nerve 7. Can you smile? Can you frown? Can you blow out your cheeks? And can you blow out your cheek? Okay. Can you close your eyes and open? Okay. And with this, I will also assess patients' taste while giving them the salty, sour, and sweet food, and also assess patients' tear with the cotton ball. And then for now, I am going to assess patient's cranial nerve 8. I will close your ear, one ear, and then whisper it into the other ear, okay?
Cats and dogs. Apple and banana.
Yes. Okay, with this, patient's cranial nerve 8 is intact. For cranial nerve 9, I will be assessing the gag reflex. So I will put my finger into your mouth. Can you do ah for me? Ah, ah. Okay, sorry. And then with this, can you swallow? Just swallow it. Okay. So with this, patient's cranial nerve 9 is intact. Can you please tell me your name and date of birth?
My name is Mandeep Singh. Date of birth is February 14, 1990.
Okay. As there's no hoarseness is present with the patient's verbalization, and patient can swallow. With that, patient's cranial nerve 10 is intact. Can you move your face to your left against the resistant? Okay. And how about to the right? Okay. How about down? Okay. How about up? Okay. And how about the shoulder shrug? Okay. Alrighty. With this, cranial nerve 11 is intact. And now I'm going to assess cranial nerve 12. Can you stick out your tongue and move side to side? Okay. And as I have assessed patient's cranial nerve 12, which is intact, and patients all cranial nerve 1 to 12 are intact, and I will document my findings. Thank you.